An awareness walk to increase focus on childhood cancer in Nigeria has taken place in the nation's capital city of Abuja. Advocates believe that rallying for childhood cancer awareness will help to increase support to children bravely facing cancer every day. Health correspondent Kemi Balogun has more.
This 6-kilometer walk through the streets of the nation's capital city of Abuja is simply to advocate for a lot more childhood cancer awareness. The walk is taking place with the theme, Steps to Survival for Children Fighting Cancer. Advocates, supporters, and some children cancer survivors and their parents are taking these steps at the 7th annual Childhood Cancer Awareness Walk to increase focus on this disease in the country. Titilayo has a 12-year-old son who battled with cancer for 6 years, but luckily is now a cancer survivor.
Thank God he's doing well. He's 12 years old now. He started when he was 6 years old. Now he's 12 years old and he's doing well. He's in JS1 now, and they gave him scholarship too.
An estimated 400,000 children and adolescents develop cancer between the age of 0 and 19 years. In high-income countries, more than 80% of children with cancers are cured, but in low- and middle-income countries, less than 30% have this advantage. Advocates here are hoping that this massive support for children bravely fighting cancer will go a long way to ensure that the government also turns its radar towards fighting childhood cancer.
What we are doing first and foremost is to raise the consciousness of government and major stakeholders that pediatric cancer is a scourge. Currently, there's so much emphasis, and I don't blame government, so much emphasis on cervical cancer, so much emphasis on breast cancer, and little or no emphasis on childhood cancer. And this is where the problem is, because children cannot on their own even tell you that they have cancer. Secondly, pediatric cancer is not detectable. You can't prevent pediatric cancer.
We have children presenting to hospital at very late stages. If there's more awareness and people know that if they get to the hospital early, they'll get treated on time, I think we'll have less mortality cases surrounding childhood cancer.
Cancer remains a leading cause of death for children and adolescents, and experts believe that the likelihood of surviving a diagnosis of childhood cancer depends on the country where the child lives due to the strengths of health systems. Kemi Balogun, TVC News, Abuja.